Myomectomy is a surgical procedure that removes fibroids while maintaining the womb intact. For many years, this has been the treatment of choice for women with fibroids if medication did not work to shrink or remove the fibroids, and particularly if they still wanted to go ahead to have children. Several types of myomectomy are available, each of them having its own benefits and risks. In this video, let's examine the different types of myomectomy procedure available and which types may benefit you. Treatment choice often depends on different factors, for example, the size of the fibroids, the number of fibroids, where in the womb the fibroids are located, as well as your own reproductive goals and your overall health. Fibroids can be tiny or grow to very large sizes. A woman may have just one single fibroid or several fibroids in the womb. Fibroids location is also important with regards to the symptoms that they cause and the best treatment option. Mainly, there are submucosal, intramural, and subserosal type of fibroids. Submucosal fibroids are located under the inner womb lining. Because of this location, they protrude into the womb canal and frequently cause heavy, painful periods. For women in their reproductive years, submucosal fibroids may cause infertility, miscarriage, or other pregnancy complications. And so, a submucosal fibroid may require treatment regardless of its size. The other main types of fibroids are the intramural and subserosal fibroids. You may also find fibroids outside the womb, such as in the cervix or in the broad ligament. Women with this type of fibroids often have bulk symptoms or symptoms of mass effect of the fibroids pressing on organs beside them like the bladder or the bowel. This type of fibroids could be treated with uterine artery embolization, a myomectomy, or hysterectomy. Some of the questions that women often consider are things like: are you having surgery with a view to bearing children afterwards? Are you interested in managing your symptoms but don't want to have a hysterectomy? These are examples of reproductive or symptom control goals that a woman might have when she's thinking about myomectomy or a surgical option for treating fibroids. The other questions could be: are you fit for surgery? Or do you have other medical problems that could complicate your surgery or even your recovery from surgery? So now we've seen some of the things that could affect your treatment choice. Here are some of the different types of myomectomy commonly used. Number one, an abdominal myomectomy. This is the traditional and oldest method where a cut is made in your abdomen, similar to what happens during a cesarean section. The fibroid or fibroids are then removed through that cut. The benefits of an abdominal myomectomy includes the ability to remove large fibroids. There's also the possibility of repairing the womb if necessary, but it is an invasive procedure with a longer recovery time, and it comes with a higher risk of complications, for example, infection or heavy blood loss after surgery. Even though it's old, this method can still be used if you have large fibroids. Number two, laparoscopic myomectomy. This procedure is performed using a laparoscope. A laparoscope is a thin, lighted instrument that is inserted through small cuts in the abdomen. The surgeon looks at the fibroids on a screen during the procedure and removes them with specialized instruments. A laparoscopic myomectomy offers the advantage of smaller cuts in the abdomen, reduced blood loss, shorter hospital stay, and faster recovery compared to an abdominal myomectomy. But remember, it may not be suitable for removing larger or deeply embedded fibroids from the womb. And number three, let's look at a robotic myomectomy. This is also known as robotic assisted myomectomy. It's a variation of a laparoscopic myomectomy in which a surgeon uses robotic arms to assist during the procedure. The robotic system provides improved access to reach the fibroids carefully with minimal damage to the surrounding womb tissue. And it's useful for more complex procedures where the fibroids may be situated in difficult to reach locations in the womb. So the benefits and risks are similar to a laparoscopic myomectomy, but robotics can sometimes improve the surgical outcomes. And we also have a hysteroscopic myomectomy. This particular myomectomy type removes fibroids that are within the womb cavity or just underneath the womb's inner lining, that is, the submucosal fibroids. A hysteroscope, which is a thin tube with a camera at one end, is inserted into the womb through the vagina and cervix. The fibroids are visualized by the surgeon and then they remove them with specialized surgical instruments. Hysteroscopic myomectomy is minimally invasive, with no outside cuts on the abdomen, shorter recovery time or stay in hospital, and minimal scarring. However, it is only suitable for certain types of fibroids, that is, those within the cavity of the womb, and it may not be effective for larger or deeply embedded fibroids. Each of these methods has its own benefits and risks, and the choice also depends on an individual's circumstances. So what are the factors that might influence your selection of a particular type of myomectomy over the other? 1. The size and location of the fibroids. Larger or deeply embedded fibroids may require abdominal or a laparoscopic myomectomy, while smaller fibroids and those located within the womb cavity itself may be treated with a hysteroscopic myomectomy. The second influencing factor is the desire for future pregnancy. Myomectomy in general is meant to preserve fertility. However, a hysteroscopic myomectomy may be preferred because of the minimal damage it provides to the womb for a woman who is planning to have children in future. The third factor is your overall health. Your surgeon may consider your general health, whether or not you've had surgery before, and your individual risk factor when trying to decide on what treatment option or method is most appropriate to recommend to you. So this is it about different types of myomectomy. But before I leave you, what about the chances of fibroids coming back or returning after myomectomy? This is a genuine fear, and there is no way to predict whether it will happen until each person has undergone their myomectomy. According to a study reported in 2021, around 15 to 33% of fibroids will come back after a myomectomy. So 10 to 20% of these women who've had myomectomy may have a hysterectomy within 5 to 10 years because the fibroids came back after their surgery. For more detail, let's have a look at the rates at which fibroids return and the time after the myomectomy, because they vary widely. Take a look. At 1 year following myomectomy, 12 to 15%. This means that up to 15% of women will experience their fibroids coming back within a year of their myomectomy. So in more context, if you have a group of 100 women who had a myomectomy 12 months ago, you might find that 15 of them have fibroids that have returned. Next, 31 to 43% at 3 years. So this is saying that by 3 years after myomectomy, over 30% of women will have fibroids that have returned. Next, 51 to 62% at 5 years. So this means that by 5 years after surgery, over 50% of these women will experience that their fibroids have come back. Finally, 84% at 8 years. So this means that by the time it's 8 years after the myomectomy, over 80% of these women will have experienced a return of their fibroids. So this is a snapshot of the different types of myomectomy, as well as some details with regards to the recurrence or return rate of fibroids after having a myomectomy. Of course, it's different for every woman, but it's essential to consult with a specialist or a gynecologist to evaluate your specific circumstance and determine the most appropriate approach or type of myomectomy for yourself. Thanks for watching. Please give this video a like and subscribe to the channel. If you've got any questions or want any clarification on myomectomy or the different types of myomectomy, do send a question to our email health information service. The links will be for you in the description box. Remember to check out our stores for our fibroid guides, trackers, and decision help tools. Check out this video next, and I'll see you again soon.